So, introduction or background. Humans are most common host, but brucellosis remains the major global problem. Brucellosis is the most common zoonotic infection caused by the bacteria Brucella. Spinal involvement may complicate the disease course, causing the significant mortality and morbidity. Brucellosis is caused by small, non-motile, non-spore forming, slow-growing, facultative intracellular gram-negative mucobacilli. Clinical presentation are vague and vague. It may cause fever, arthralgia, or are most common. Can involve multiple systems, including spine. Disease transmission to human occur through the consumption of unpasteurized animal product, direct contact with the animal tissue or inhalation or the urine contact. Estimate more than 5 lakh new cases globally. Most common is in the region where the most common area is come. Asia is also there. Osteoarticular involvement is 10 to 85%. Brucella spondylitis is among the most serious manifestations associated with the complication such as epidural, paravertebral, and psoas abscess are possible and possibly neural involvement as well. Many articles and routine protocol doesn't support brucellosis screening. So this is a retrospective series of 7 patients from January 2024 to May 2024. Uh, and medical is compared demographically with clinical presentation, diagnostic case, treatment, complication. Uh, Diagnostic test use is IgG, IgM blood culture, blood lab. So the result, um, 5 were female and 5 were male and 2 were female. Among the occupation, one is student, one is housewife, which does not have any contact with the animal. Other 5 people are either farmer or a mutton shop owner, which have direct contact with the animals. So rural and urban area, there is not much difference. And we managed 5 patients with surgically and 2 patients with just biopsy and conservative management was done. In 3 patients, IgG was negative. 4 patients, IgG ELISA test was positive, and IgM is also positive in all the 7 patients. So preoperatively or pre-conservative management ESR and CRP level was high, which came down significantly after starting the treatment. We took the follow-up up to the 3 months. No complications in all the 7 patients. So this is the first case. Is 38-year-old male with complaining of low back pain and left more than right lower limb radiation. History of fever was there. Power and neurology was normal. So we diagnosed it with L4 alpha spondylodiscitis and IgG IgM lab was positive for the same. So we treated the patient with doxycycline 100 mg and rifampicin 600 mg conservatively only. After the biopsy, we started this protocol. Case 2 is pain in the right buttock, difficulty in standing and walking. Patient was nil medically. He was also diagnosed with right sacroiliitis. We did the debridement and took the sample and sent it for the investigation, which came out to be the brucellosis. We also started him on the capsule doxycycline. So high clinical suspicion is needed as brucella is underdiagnosed and is not notifiable in India. Gold standard diagnostic measure is culture, but serology, IgG, IgM is routinely done. As in culture, there is difficulty in temperature monitoring and fungus growth occurs simultaneously along with the bacterial culture. So it is not routinely practiced in India. Rural residents, livestock exposure and raw milk consumption are epidemiologically clues in brucellosis, but the patients are not belonging to the above criteria can also be screened for brucellosis if suspected. Brucellosis is the most common but neglected zoonotic disease. Brucellosis should be considered in differential diagnosis of infectious spondylodiscitis, sacroiliitis, similar to tuberculosis, even when presenting with the vague signs and symptoms. Awareness of risk group is needed to take appropriate preventive measures to accept the control measure. These are the references. Thank you.